I'm Shane Bales, Doc Hockey for Pro Action Sports Injury Clinic. Exercise we're doing today is our PAILs and rails external rotation of the knee capsule. All right, we want to thank Dr. Andreo Spina, who is the one who created this. All right, so what we're going to be doing, we're going to be going down onto the floor. We're going to have our knee bent, okay? We're going to have our outside hand going on the outside part of the upper thigh bone, okay? So we're going to be holding it here. This one, we're turning the foot externally, so we want to make sure that we're getting rotation through the tibia and the femur and the kneecap. So this is the joint we're working on moving, not the ankle joint. Okay, so we hold the outside part here, we bring it out, and then we work on our bracing, right? So we're bracing through our core, through the legs, everything else is holding tight, even through our shoulders, so everything is tight and putting the pressure down and towards the knee. All right, so we hold this for a passive stretch by breathing into the diaphragm, trying to increase that range of motion right in through here, through the tibia, okay? So after we do that for about 2 minutes, then we're going to resist that contraction. So we're actually moving the foot inwards towards the hand, so against resistance there without moving the joint obviously, but there is resistance. Again, there's some muscle contraction going the other way, and we're just holding that there, okay? After we do that for 2 minutes, now we're doing our rails contraction, okay? So our rails contraction is now we're going into external rotation or outward rotation with the foot, so we're actively trying to contract that. You should feel contraction through the muscle here and through the foot going outwards along those lines, and even trying to bend this towards this. So we want to make this angle on the outside part of our leg, so from here to here, decrease. So as we push it through here, all right, now with the active range of motion there, that's our rails, all right, we hold that down for 10 to 15 seconds, still contracting the whole body. Then we relax, we do another passive stretch, once again, breathing into the diaphragm, keeping the bracing, right, for another a minute and a half or 2 minutes. Then we go backwards by putting pressure of the foot going internally again. So this is going this way and I'm holding that resistance without moving it. All right, and then we go with our rails contraction by pushing the foot outwards, trying to get that increased external rotation actively with our muscles. Okay, and we want to be increasing the range of motion each time. So it's done to about 2 to 3 sets with that. All right, so if we look up here, all right, we did our knee capsule outward or external rotation. That's what we're trying to do. Passive stretch with diaphragmatic breathing for about 2 minutes into external rotation. PAILs is where we do it for 2 minutes against kind of resistance into internal rotation, so the foot's coming inwards. Then we have our rails for 10 to 15 seconds, going back to external rotation with active muscle movement to bring that tibial joint and femur joint outwards, okay? So that's what we're trying to accomplish with that, and it's often very good for ACL injuries and so on and so forth. So try that exercise out. Hope you had a great time. I'm Shane Bales. Have a great day.